Over 30% of babies are born through C-section today, and while some are life-saving, many happen unnecessarily. Are there things you are doing unknowingly that might increase your chances? In this video, we will break down what actually leads to a C-section, clear up dangerous myths and explore real mistakes you can avoid for a smoother, safer birth. Let's begin. What is a C-section? A cesarean section is a surgical procedure where the baby is delivered through an incision in the abdomen and uterus. Though it's often considered routine today, it's still a major operation. It usually takes about 35 minutes to an hour and requires weeks of recovery. Risks include infections and blood loss, reactions to anesthesia, injury to nearby organs, increased risk of complications in future pregnancies like uterine rupture or placenta previa. Number 2. Medical reasons for a C-section. Sometimes a C-section is the fastest choice and safest choice for both mom and baby. Let's look at valid medical scenarios. Prolonged labor or dystocia happen when labor stops progressing even after several hours. Could be due to weak contractions, baby's head not fitting through pelvis or cervix not dilating. Fetal distress. Detecting through fetal heart monitoring signs like a slow or irregular heartbeat suggest baby isn't getting enough oxygen. Breech or transverse position. Breech, baby's feet or buttocks come first. Transverse, baby is lying sidewise. These positions increase the risk of cord prolapse or injury during vaginal birth. Multiple births. If the baby's head down first or if the second twin is in the distress, a C-section is often safer. Placenta problems. Placenta previa. Placenta covers cervix. Vaginal delivery is not possible. Placental abruption. Placenta detaches early, cutting off oxygen to the baby. Umbilical cord prolapse. Cord comes out before baby, cutting off blood flow, a surgical emergency. Previous C-section with vertical scar or uterine rupture risks. Number 3. Avoidable factors and common mistakes that increase C-section risk. Now let's discuss avoidable mistakes and lifestyle choices that slightly raises your chances of needing a C-section. Inactivity during pregnancy leads to a poor pelvic flexibility, weak uterus muscles, and lower endurance during labor. Sedentary moms often experience longer labor and fatigue that prevents pushing. Excessive weight gain and poor nutrition. Overeating or unhealthy diets can lead to gestational diabetes or macrosomia, very large baby. A large baby increases risks of shoulder dystocia and stalled labor. Stress, fear, and lack of mental preparation. High levels of cortisol and adrenaline interfere with labor hormones. Fear causes tension in the body, which can slow dilation and increase pain perception. Early admission to hospital. Hospital often have timeline if labor isn't progressing fast enough. Intravenous begin, pitocin, breaking water, epidural, all of which can cascade into a C-section. Stay home until contractions are 3 to 5 minutes apart, 1 minute long or over an hour. Unnecessary inductions. Elective inductions with no medical need often fall if the cervix isn't ready. Failed inductions frequently ends in emergency surgery. Overuse of intervenations. Continuous fetal monitoring restricts movement. Epidurals too early can slow contractions. Lying on the back decreases blood flow and slow labors. No birth plan or advocacy. Not communicating your birth preferences or being alone in labor can lead to decisions made in haste. Having someone to support your partner, doula, or family is crucial. How to reduce your risks of C-section? Here's what you can actively do to protect your chances at a normal, safe birth. Stay active. Walk daily, do prenatal yoga, stretch, do pelvic floor and squatting exercises. Eat right. Focus on iron-rich foods, fiber, protein, and avoid processed sugar. Maintain recommended weight gain, usually 11 to 16 kg depending on pre-pregnancy weight. Educate yourself. Take antenatal classes, which birth stories, read up on labor stages and breathing techniques. Choose a supportive provider. Look into their C-section rates. Choose one of who supports VBAC, natural birth and informed choice. Hire a doula if possible. Continuous emotional and physical support reduces anxiety and C-section rates. Have a birth plan. Clear, write your preferences, natural labor, limited in interventions, mobility, etc. Share it with your doctor and birthing team in advance. Wait for active labor. Stay at home during early labor. Move, eat, and rest until contractions become strong and regular. Final thoughts. Birth is a powerful personal journey, not a medical event by default. While C-sections are sometimes necessary, many happen due to fear, pressure, or lack of knowledge. By preparing physically, emotionally, and mentally, you can reduce your risks and increase your confidence. If you found this video helpful, please like, comment, and subscribe. Tell me your thoughts or questions below. I'd love to support you more. Until next time, stay strong, stay informed, and trust your body.